Well, the Eastern Cape Health Department has delivered state-of-the-art equipment to help curb the TB infection rate at a severely hit correctional services centre. More than 500 inmates there are struggling with the disease in correctional services centres across the province. 200 of these cases are at the St. Albans Correctional Centre in Port Elizabeth. Today, Health MEC Zandile Myeza delivered the resources to the facility. South Africa has one of the highest rates of TB prevalence in the world, with the Eastern Cape one of the hardest hit provinces. The new equipment will speed up the treatment process. The machines are able to detect if a patient suffers from TB within 2 hours. The health department also donated 5 machines that will be used at the Motherwell area. Well, now, in a move to tackle the century-old TB scourge among mine workers, the Minister of Health and Mining from Lesotho, Mozambique, South Africa and Swaziland are meeting with mining industry and union representatives today at a ministerial meeting in Johannesburg. Now, the aim was to discuss a standardized approach to the management of TB in the mining industry across all 4 countries. Now, the ministerial meeting on harmonizing the response to TB in the mining sector is being convened by the government of South Africa and supported by the World Bank, the Stop TB Partnership and the Global Fund to fight AIDS, TB and malaria. About 500,000 mine workers in South Africa and about 2 million ex-mine workers spread across the 4 countries are at high risk of TB in a sector which has a net asset value of $1.8 trillion, with mineral exports accounting for nearly 9% of South Africa's GDP. Well, standing by with an update for us is SABC News senior researcher Zandile Myeza. She's at that meeting in Sandton and she joins us live now from the convention centre. Over to you, Zandile.
Yes, good afternoon. And yes, we are still indeed at the Sandton Convention Centre. The conference is currently underway. Some startling figures were emerged to us today, and we learned that South African mine workers have the highest TB prevalence in the world. We also learned that gold mining has been linked to a lung disease, namely silicosis. Dr. Patrick Oseo from the World Bank spoke to us earlier on and about the prevalence of tuberculosis, and this is what he had to say.
So why is TB such a high burden in the mining sector? First, because in the mining sector, mine workers develop silicosis. This is inhaling silica dust that inflames their lungs and therefore makes them susceptible to TB. So silica is a major driver of TB in the mining sector, and those who have silicosis are 6 times at risk of acquiring TB. There's high levels of HIV, and for mine workers with HIV, their risk levels are 3 times compared to the general population. The other challenge that mine workers have is that they live and work in poorly ventilated and overcrowded environment. Most of them, some of them have poor access to routine health services, particularly contract workers. Some of the companies have done an excellent job of providing services to employees and contract workers, but some companies have not done that. And this is part of the reason why we are all here, to see how we can collectively work to ensure that all mine workers get health services.
At a media briefing this afternoon, the Health Minister, Dr. Aaron Motsoaledi, spoke to us a little bit more about the situation of tuberculosis in South Africa. He told us about his plan of action. He speaks about screening about 500,000 mine workers and doing follow-ups with their families. However, at the moment, the Department of Health speaks about how they have a challenge in collating a comprehensive strategy in being able to track down mine workers in terms of compensating them. Dr. Barry Keshnasemi speaks to us a little bit more about this issue.
We don't know how many ex-mine workers there are. So it's a fundamental flaw in the system that we don't know, and that's why one of the big issues is around the tracking and tracing issues that we need to sort out. The Deputy President of our country led a very significant process to deal with the Eastern Cape ex-mine workers. And that showed us the flaws in a system where, although we had Home Affairs, the Independent Electoral Commission, the Department of Mineral Resources, the Department of Health, the Department of Labor, all around the table, yet we could not succeed in actually reaching out to ex-mine workers in the Eastern Cape. There's about 4,000 that we can't find at this moment in time. Another critical problem that faces mine workers is they have to have a labor history. But there's a concept called controlled mines and non-controlled mines. It's part of the problems around the legislation, but this is one of the other issues. And workers don't know what was a controlled mine or what was a non-controlled mine. And also as Patrick Oseva pointed out, there's the issue around secular migration where they move between mining houses. And sometimes they might be in a non-controlled mine or in a controlled mine. And one of the issues, we need to get a labor history. Of course, unfortunately, as bureaucrats, we say to them, there's a thing called Public Finance Management Act in South Africa, which governs my delivery of compensation services. So I've got to tell the worker from Gaza province in Mozambique, please go and tell me where did you work. Remember, many of these dust diseases we're talking about, TB, silicosis, etc., comes 20 to 30 years after the exposure took place. So the mine has long closed down. All the person knows that he works in Clarkstop or Velcom or in Burgersfort, the ex-asbestos mines. But he doesn't even know the kind of issues. So the labor issue has to get, and the agency that's dealing with that in most instances is TEBA, and they've got to contribute something to pay for that. One of the critical areas, and our Director General is leading a major initiative on a surveillance system, not just for occupational health, but there's a range of diseases that we don't track in South Africa. And one of the key areas is that we don't know what's the quantum of injuries and disease in the country. And of course, human resources. South Africa has only got 40 occupational medicine specialists. We've got 2 occupational hygienists. The Minister of Lesotho alluded to silicosis. Minister, the tragedy is that we've got 2 PhD-trained occupational hygienists in South Africa. These are the people that ought to measure the dust, measure the risk, and tell our minister, in terms of through the risk committee, tell the Chief Inspector of Mines, who is present here today, Mr. Myeza, what are the risks in mining? And we've got 2 PhD-trained occupational hygienists in South Africa. If I had to ask you if you've got such a person in your country, not even at a master's level. So these are some of the issues that face us when we start looking at occupational health nurses, doctors that work in the industry, occupational hygienists, etc.
President of the Southern African Mine Workers Association and a former mine worker himself, Rantu Manzi, spoke to us earlier on about the challenges facing TB in this country. He spoke about challenges regarding the treatment as well as issues about language barriers. This is what he had to say.
When these people return back home now, the mine bosses, they are also the business people. They are concentrated in making of the profits only themselves. So when this man is going back, they are not too much interested in what is happening with that person, They are interested in looking forward to who is coming to their services, so as to give them the production and the whatever that can benefit them, So we think if we can be engaged, our organizations, in that exit interview, so that we can verify very well that this person has got the information that is relevant to what is going to happen with himself when he is there out, that will be good for us.
On the 7th of April this year, we will see the opening of a new tuberculosis treatment and diagnosis center that will be launched in the Eastern Cape. This is one of the ways that South Africa is trying to prioritize treatment and diagnosis of tuberculosis in this country. Tuberculosis remains a social, development and economic issue and will still remain a political, interesting and very much so important issue on the African region. Back to you in studio.
The SABC News senior researcher Zandile Myeza, thank you for your time. The United Nations Human